Hey, everybody. Welcome to meddkit's Provider Spotlight, where we interview really the most amazing and fabulous private practices all over the United States. We're always interviewing someone new, someone interesting, and that has a lot going on. And so today, I want to introduce you to Dr. Tess Volner of Total Care Chiropractic Integrative Wellness Center. She is amazing, and I know she's got a lot to say because we've already been chit-chatting a little bit, and so I kind of want to dive into doing this with you, Dr. Tess. I think this is going to be awesome, and excited to hear more about you. You ready?
I'm ready.
Okay, cool.
I'm ready.
Awesome. So would love to hear about your story. Would love to hear what inspired you to open up your practice, and what's going on there. What do you do?
Well, the short story is my daughter, my third child, threw out my back, and I ended up at a chiropractic office.
Ah,
And insurance ran out, and I ended up at the chiropractic college because I'm in Kansas City area.
yep.
And of course, somebody there said, if I can do this, you can do this. Because I was actually looking for a career opportunity. Like, what do I do so I don't drive my kids nuts when they're getting their own children? Do I hover over them or do I have a purpose, right?
Sure.
So that's how I ended up in chiropractic care. And it's been amazing. But I've extended beyond that with the DABC program, Learning Chiropractic Internal Medicine. And so I've kind of developed a holistic practice, thus the name from the beginning was Total Care Chiropractic. And I've since also opened Total Care Health Solutions that is focused in on reversal of diabetes online. And I am working through urinary expertise with incontinence with a new device I have called EMSELLA. And so I have now I'm spreading slowly out into, I have hyperbaric oxygen, laser therapy, decompression, EMSELLA, incontinence, pelvic floor strengthening, as well as natural medicine. And even my natural medicine expertise is crazy because I get the hard cases and then we start investigating. What we were talking about a few minutes ago was a new patient that has something rare and unique in a skin cancer. It's a T-cell lymphoma that's attacking her skin, creating plainness and really thick, ugly skin. Eventually, she'll lose her hair and just be very uncomfortable with appearance and itch all over. So what do you do with that? If you hyperbaric oxygen it, like I do other internal cancers that have disappeared and tumors have disappeared, and I mean, it's been great, breast cancer, prostate cancer, and we've been able to use EMSELLA a little bit with those. But this was unique. So I've spent more than just 2 hours, but this morning I hit upon something that'll be very effective. Reading for 2 hours about not only how one extract helps skin cancer and multiple difficult cancers like bladder cancer and pancreatic cancer. Those are really difficult to heal. But hey, the side effect of blood sugar control and cholesterol lowering elements is not harmful at all. I'm excited to find this for this client of mine. So I'm excited to share I just have a passion to know, like, we're not guessing. We know where we're going. And I check all the side effects because I have another client with metastatic cancer that is started in the lungs and is in the liver and in the brain and now in the bone. And he doesn't live near me at all. So we have gone through lab testing, we've gone through other tests, and the challenge with anyone is when they're Googling, going to Dr. Google, to find answers, right?
Yeah.
And it's so confusing. Like, oh, is chamomile so good for cancer? And is this, turmeric is so good for cancer? And so how many pills do you want to take? How many piles of turmeric do you want to take, knowing that it's not going to absorb well, and it may not be the best thing for that particular cancer?
Yeah. I mean, I love what you're doing because it's like, when you think about, your business name, total, at least in the beginning, Total Care Chiropractic, you're so much more than that. And you're so much more than, a lot of physicians out there that, anyone would, you know, fall on the floor if they knew that their provider was taking 2 hours to just look up their very specific, ailment, which is so awesome of you. I mean, kudos for like going down the rabbit hole and trying to figure it out.
Thank you. But it also has to do a little bit with my own ADHD kind of hyper focus on something, but that's a benefit. You want, like, even if I tell people, if I want to go to a physician for something, I want them to be the nerdiest guy ever.
Yeah.
Because they're going to know. I don't want the popular guy. I don't want whatever. I want the nerdy guy who knows everything. And that's going to get me a cure, right?
Yeah. Yeah.
So that is so fun. But yes, when you're dealing with so many different kinds of ailments at once, like he presented me with 15 different other items that he thought would be a great idea. And I said that that one harms the liver, that one harms the lung, that one harms, I mean, if we're gonna do all three, get the brain, lung, bone,
Yeah.
and liver to be healthy, we have to not damage one for the sake of the other.
Yeah.
So that's my research, trying to put it together for you, custom packaged, so it's not going to hurt one thing while we're curing another.
Yeah.
We may enter that realm for short periods of time, but not for long periods, because he also is getting hearing loss and visual loss from the swelling.
Sure.
So we've allowed one medication that could interfere with lung while for a short period of time to make sure that that swelling goes down and he doesn't completely lose his visual or auditory. So
Yeah, that makes sense. Now, we've heard some of your really difficult cases, but are there things that you see in your practice that people are most often struggling with? Like, do you have something that is very often recurring, people coming in every day with something?
neck pain, back pain, and emotional pain.
Mm.
Being part of total care, we're also learning some techniques. I don't even have to know what the problem is. This is not a counseling session. I ask a few questions. You can share if you want, but
Yeah.
emotional pain. We've been able to drop physical pain 50% just by dealing sometimes with the emotional pain that comes along with that old injury. But yeah, I see necks, backs, ankles, knees, shoulders, all of those things. So they're not difficult, they're common. And it's just like urinary incontinence. It's common, it's not normal. We don't want to keep it. We want to heal it. Let's just heal it and get it over with.
Yeah.
Balance, stability. The EMSELLA has been not only great for because it's FDA cleared for urinary incontinence, but it is also stabilizing for balance.
Can you tell us a little bit about what that is and some of the modalities you use in your practice? Because I'm hearing you bring up all these different ways and different treatments, and I'm just kind of curious, what maybe some of, the popular ones are for you that you've seen to be really effective.
So the most, EMSELLA is the newest.
Yeah.
EMSELLA is a chair you sit on, but the energy from it is high intensity, focused electromagnetic energy, and it pulses into your pelvic floor. So we have you sit in the center so it's aimed properly in the perineum, and it creates a hyperplasia of the muscle or a strengthening. I'm not sure who I'm talking to as an audience. If it's physicians, it's hyperplasia. If it's regular folks, we're building strength. We're building strength at the cellular level. And that cellular level includes stem cell release. So unlike physical therapy, where you go in and they maybe put a TENS unit on there, maybe create some kind of muscle contraction, we're stimulating cellular hypertrophy and stem cell release. So everything I'm doing in the office, it has to do with stimulating your own body's healing capacity. Stem cell release means those new cells, and you've probably heard it in the news, stem cell injections into knees and shoulders and joints. Stem cells, stimulating your own stem cells, are like baby cells that haven't decided where they're going to college and what they're going to major in. And so
I like that.
So when they're released, they go to any place in your body that is wanting healing, and they become those cells and kind of patch up and create new cell structure in the area. So you don't get healing with scar tissue, which doesn't have a blood supply and doesn't flex well and doesn't grow. You have healing with real live cells that it's long lasting. So physical therapy for pelvic floor strength takes you 9 to 12 months to build strength. If you can feel what it means to contract that muscle grouping, it's difficult for those who are older than me, who have more damage than I do, to even feel how to hold their urine.
Yeah.
So EMSELLA builds that strength with new cells, young cells. So it's kind of like longevity healing, right? Anti-age healing. I love anti-age healing.
That's cool. I love
that. So it builds that strength, stem cell release, muscles are stronger, and the healing continues for another 3 to 6 months. And it holds for another year because we developed new cells, right?
Right, yeah.
We didn't just scar tissue heal up something. We developed new cells.
That's
so
really cool.
Continued healing. And it holds for at least a year. I had a guy with a very unstable back. So this is not related to incontinence at all.
Yeah.
So don't embarrass him. You never know why people are using the machine. So you can't just assume everyone has incontinence. But yeah, he sat on the machine for 6 visits in December. 7 months later, he felt a little bit of weakness in his low back because he has what is called an anteriolisthesis of his spine. It means instead of being lined up, one of the bones has moved forward and is unstable. And it was unstable. MRI showed it. It may have become a surgical issue down the road. He has to wear a brace.
Yeah.
So the EMSELLA developed enough strength in the area that I didn't even adjust him for 7 months.
Wow.
So he just for low back stability. Yeah, how about that? And that's just the EMSELLA. So stem cell release in the office. We use herb therapies. We have hyperbaric oxygen. And until EMSELLA, hyperbaric oxygen was my only source of stem cell release in the office. And so it is good for traumatic brain injury, stroke, concussion. It's also good for cancer. Not all cancers, but most cancers. It is very good for reducing tumor, helping autoimmune disease, reducing inflammation. It is helping so many things. After 20 visits, 15 to 20 visits, it causes your whole body's bone marrow stem cell release for all your whole body's healing. So that's why it's so effective. And it's not terribly expensive either. So
Really?
$400 to $800. I mean, if you do a lot, $1,600. And
yeah,
you've got a
affordable.
whole body longevity, stem cell release, and it's kind of isolating. You're inside of a chamber for a whole hour and creates relaxation, creates a sense of wellness just from having time to rest. Some people take work in the chamber with them. Some people take their children in there. We've used it for autism.
Oh,
Yes.
that's
Yes.
super interesting. Oh, that's cool.
Within about 10 visits, this young 4-year-old was able to understand dad's commands and follow them. So I'm just surprised regularly, even though I know healing is happening here, I'm surprised regularly.
That's so cool. I feel like you are seeing and doing it all with all different walks of life, all different types of ailments, all different types of modalities, all the things, which is very cool. But something that I'm curious about, because you do so much and there's so much information out there, and you alluded to it earlier, and it's probably one of my favorite questions to ask is Dr. Google. Dr. Google is out there. Dr. Google says a lot of things. People rely on Dr. Google a lot. And so, what if you could tell us, like, I'm sure sometimes there's things that you just feel like you're a broken record about, and you're like, I wish you didn't read that, and I wish you would stop reading it and continue to read Dr. Google on this subject matter. What is something that you feel like you'd like to put to like bed today? You know, something that is just commonly coming up that you're like, yeah, no, like this is so wrong. The internet is saying this, but this is what you really need to know. What do you think one of those things might be?
Actually, I want to say I commend you all for searching out your own health and becoming more responsible for your own health. Because I've had people walk in and say, why should I stretch? I'll just come in and you can do it for me. Why should I brush my teeth? I'm sure is what a dentist would say, right? Why should I clean my teeth? I'll just come in and have you guys do it. I commend you for searching out answers, but not all answers are your answers. Because this is one thing there's multiple things I do. I also do genetic testing.
Ooh, that's cool.
Because I've had my own ailments for many years. And we were laughing earlier. I just told God, don't give me anything else. I don't need to get sick to help people. Because a lot of the reason I have all of these things is I use them myself in order to stay well. Even a few years ago, they thought I might have had MS.
Wow.
We were able to discover what it was, what I need to do. If I were to just depend on Dr. Google for my symptoms, I would never be well. So you can't just depend on Dr. Google because it's not the full story, the whole picture. And even I keep learning that there's more to a specialty than just with like urinalysis. It's not just you go to the urinologist and they're just dealing with your urine. They know how the entire system works and why everything you've done in your life has changed that and what's to be expected. If you go to an eye specialist, they know what all the changes are and what's to be expected. Sure. And yes, there are things that you can do to prevent serious ailments. Eating your carrots keeps your eyes healthier for a reason, but it also keeps your liver healthier and your kidneys healthier and everything else. So yes.
That's a good answer. Yeah, I think people that want to dive into their own health, good on you. You're taking like a good first step, right? And then you're
True.
getting the help. So that is awesome. I totally agree. But then I also agree with what you said is that you can't look at everything and see it as written in stone and that's exactly what is going on with you and that is fact all the way 100%. So,
I remember a story of one client that we had the most difficult time with. She was allergic to everything. And she was going through Dr. Google and trying to narrow down everything. And she was eating chicken and fish only and vegetables and organic and grass-fed and the whole 9 yards.
wow.
I said, well, you're allergic to everything. You can't even walk out of your own house. Let's test. You need to test instead of guess. So she had done all of the work and it was good. I didn't have to teach her what healthy eating was like.
Yeah.
But it turns out the one thing she was eating the most of, she was allergic to.
Of
So
course.
that's why testing is so important.
Yes.
You do need to find out for you.
Yeah.
Because we all need to eat. We all need to eliminate. We all need to sleep. We all need certain things. But maybe my body
Yeah.
can't handle lactose anymore. Maybe my body can't handle the preservatives in wine and cheese. So maybe, right?
Yeah.
So then
No,
you
it makes sense.
test, and then you know, this
Test
is
and
why
verify.
I can't eat pizza anymore, right?
Yeah.
Which
And your
is
body
my
goes,
favorite food, by the way.
yeah. Hey, yeah, your body goes through changes too. What you might have been able to eat all of a sudden doesn't work for you. So I like your thinking, test and verify, and
Test, test and not guess.
yeah,
Yes.
test and not guess. I really like that. In terms of, looking at people's overall wellness and kind of what you've seen in your practice, what do you think are a few easy tips or common homework that you might give to a client? Are there things today that can put us in, you know, a better spot tomorrow?
So there's a few do's and a few don'ts.
Oh, I like that. Let's do do's and don'ts. Yeah.
Do get your rest. Because if you can sleep, you can generate serotonin and feel better. You can cope with life in general. You can handle extraneous children screaming in your ears and not get so nervous about going to work and, meeting deadlines and stuff like that. Sleep is so important. The second thing would be water. Or how about if we just call it, let's eat and drink real food.
Yeah.
Because if you're consuming real whole things in the shape it was in, apples versus apple juice, oranges versus orange juice, broccoli, even over green drink powders and things like that. If you can consume the real food,
Yeah.
because what we know about an apple, there's over 300 elements, some of which are not named, that are good in an apple. If you eat an apple or 3 apples a day, you can lower your cholesterol and manage some blood sugar. Fascinating enough, being an apple, being sweet. But there's 300 elements in an apple, and the one element that goes into a vitamin pill is boron. So all of those 300 elements were important for a reason. Your fiber, soluble fiber, insoluble fiber, all of those elements that help to feed your health, your whole body's health. So eat whole food. So we have rest, eat and drink real things. What would be a third? Move. Find an activity you like to do. I'll ask you a question.
Yeah. Oh, first time that's ever happened. Okay.
What is the best exercise?
Okay, putting me on the spot here, but I would say maybe just walking.
It's a trick question because it has to just be the thing you will do.
Ah, okay, yeah.
It has to be
Yeah,
the thing you will do. So dancing is great exercise. Dancing is the best exercise to help prevent Alzheimer's because it includes the emotion of music. Because
very good.
music is very emotional and that creates memories, and memories have links, and you can wake up memories just by listening to a song you knew.
That's awesome.
So dancing, gardening, octogenarians and older say anything that's active.
Yeah,
So you're physically moving, you will keep moving. The other thing they say for longevity is community. So stay connected to people. Join a church, join an organization, have people over for dinner. Just doesn't have to be a lot of people, could be one or two people. I have children who love to hang out in groups and concerts, and those who do not. We want quiet as possible. They want to go to a restaurant that's closed, so no one else is there.
I know people like that. Yeah,
But we still need to be connected to each other. So
yeah.
those are the four things I find that are most important to your health.
I love that, and it makes a ton of sense. Completely.
And let's go through a couple of don'ts.
Okay.
Don't condemn. So there are three words that we say all the time that are very condemning. I shoulda, I coulda, I woulda, if, right? If is like the worst word ever in our emotional health, right?
Mm.
So don't tear yourself down. Just start from today. Today's a new day. We're going to do what we're going to do today.
Yep.
Tomorrow's gone.
Yep.
Give yourself. So let's not condemn.
I like
And I
that.
think of another don't. Don't try to do everything. Add one thing a day or a week that's going to move you forward in your health. Because if you do that, those who lose weight and keep it off the longest start something and then continue that onward.
Yeah.
If you start this, then that, then that, then that,
Doesn't
there's
work.
not a consistency. And it's hard. I have ADD, so it's really hard for me to not just start a new project, right?
Yeah.
So start, stick with it. If it works, great. If it needs a little tweak, tweak it.
Sure.
And then when that becomes a habit, then it becomes a long-term habit, then start a new one. Don't do it all at once. Shotgun approach never works long-term because we get fatigued.
Yep. We don't
So
want to do
there's a
it
couple of
anymore.
good don'ts.
I love it. I think the do's and the don'ts were great. And the first time anyone's ever asked me a question, so that was cool. So I think this was amazing. Dr. Tess, I had such an awesome time with you. I think this was fantastic. If you don't mind telling folks how they can reach out to you or find you online, that would be great.
Awesome. TotalCareChiro.com, TotalCareChiro.com, or Total Care Health Solutions if you are fascinated in reversing diabetes. Same thing, Total Care Health Solutions with an S.com. And you can reach me through either one. And 913-383-8505 is the direct landline to the office. And you can jump on Facebook. Teresa Tess Volner, Total Care Health Solutions, Total Care Chiro. And I have a reversing diabetes group called, oh, I'm on my own spot now. Um,
You can always drop the link in too, Dr. Tess.
okay, goodness, balance blood sugar like a winner.
Ah, very clever.
Because the winner is even an acronym for the diabetes program. It's brilliant.
That's awesome.
Yeah,
I'm so appreciative of everything that you shared with us today, and we hope to have you on again.
very good.
Thanks so
I
much,
look
Dr.
forward.
Tess.
Have an amazing day.
You
Thank you,
too.
Rachel.